Pressure ulcers, also known as bedsores, are a serious health concern. They are painful wounds that develop on the skin and underlying tissue. This happens when there is constant pressure on a specific area, restricting blood flow. People who are bedridden or use a wheelchair are most at risk. The Norton Scale is a tool healthcare professionals use to assess the risk of a patient developing pressure ulcers. The Norton Scale helps nurses and doctors create a care plan. This plan includes preventive measures to protect patients. Early assessment is crucial in preventing pressure ulcers. This is because early intervention leads to better patient outcomes. The Norton Scale is a simple and effective way to identify those at risk. The Norton Scale assesses patients in 5 key areas. These areas are physical condition, mental state, activity, mobility, and incontinence. Each category helps paint a picture of the patient's overall risk. Physical condition assesses the patient's overall health. This includes factors like their weight and if they have any nutritional deficiencies. Mental state refers to the patient's awareness and alertness. A confused or disoriented patient might not be able to adjust their position to relieve pressure. Activity measures how active the patient is. This could range from being bedridden to walking independently. Mobility looks at the patient's ability to move themselves. Can they turn in bed or sit up on their own? Incontinence refers to bladder or bowel control. Moisture on the skin can increase the risk of pressure ulcers. Each category on the Norton Scale is scored from 1 to 4, with 1 being the most severe. A score of 1 or 2 in any category indicates a high risk of developing pressure ulcers. The scores from all 5 categories are added together. A total score of 14 or less suggests a high risk of developing a pressure ulcer. A score between 15 and 16 is considered a medium risk. These patients need frequent monitoring and preventive measures. A score of 17 or higher means the patient is considered low risk. It's important to remember that even low-risk patients can develop pressure ulcers, so regular skin assessments are still vital. Preventing pressure ulcers involves different strategies based on the patient's risk level. For patients with a medium to high risk, frequent repositioning is crucial. This means changing their position every 2 hours. Special mattresses and cushions can help distribute pressure evenly. Keeping the skin clean and dry is essential for all patients. Good hygiene practices help prevent skin breakdown. For patients with incontinence, using barrier creams can protect their skin from moisture. Nutrition also plays a key role. Providing patients with a balanced diet helps their skin stay healthy and promotes healing.